So good morning, everyone. On a colder day in downtown Humble, we have a special guest this morning for the Breast Cancer Awareness Month that we're in the middle of, and it's something I'm gonna have to produce pretty quick to get it out there for the general public. But I am happy to have someone with very important topic for our community. It is Dr. Matt Wright. He is with MD Anderson. He is a breast medical oncologist. So first off, Dr. Wright, thanks so much for being here this morning. Thanks for spending some time with us, and thanks for helping to educate our community.
Absolutely. Good morning. Yes, thank you for having me. It's an honor to be here.
Yeah, perfect. Me and him were talking before this, and kind of what path did we want to go with this interview? And I think the correct path to go is the process, right? So whenever a young lady or young man has a change in their body, they need to be cognizant of that. So why don't you kind of tell us, what should someone be looking for, feeling for, how often, those kind of things, to make sure they're keeping themselves safe? Because really, as patients or as people, right, we've got to make sure our prevention is first. We take ownership of it a bit and do what we can to protect ourselves. And then when that happens, what's the next step?
Great. Yeah. So having breast awareness is critical. So it's really important. We tell patients to have really good understanding of what their breast tissue feels like at baseline. If they notice any changes, if there's any lumps, bumps, if there's anything in the skin that looks different, that wasn't there before, that's new, if there's changes to the nipple or areola or nipple discharge that's new, it's definitely important to call attention to your doctor, schedule an appointment to get an exam, get some imaging to further work this up.
All right. So what you're saying is the first step not necessarily should be to go to maybe a specialist like you, maybe go to their own primary care physician. Definitely. And then let them go, hey, look, we probably need to pursue something, or I think you're okay kind of theory. Is that right?
Definitely. It's best to see your primary care doctor first, have him or her examine you, also get some imaging to further work it up. But that's a great place to start.
Okay. So MD Anderson, I think everyone in our community knows MD Anderson. It's a powerful name. So I grew up, I was born and raised in the Dallas-Fort Worth area. And everyone I knew, and we all knew this all throughout the state of Texas, knew if you had some kind of cancer treatment need, to definitely head towards Houston. It's a known thing. And I was actually reading an article on best cancer centers in the world, and there are several here in the United States. There's several in other countries, but MD Anderson tops that list again. There's some other ones, and there's one in Cleveland. There's a lot of them tied to universities, those kind of things. But it's nice to know that we have something so close to treat something so common, unfortunately. So why don't you tell us a little bit about locations here locally, and then we'll go through kind of the process of what you and your team do when they do have a screening need.
Yeah, so MD Anderson has been consistently ranked #1 best cancer center in the nation and also in the world. So I'm a bit biased, but I do think we have really a great, not only just history, but also a great team as well. It's a very large academic cancer center. We have several hundreds, if not thousands, of patients on clinical trials. And we do have a very large footprint here in the Houston area, which a lot of our local residents may not realize. I know we have a very large campus at the Texas Medical Center near downtown Houston, but we do have essentially what's called the Houston area locations, which are a few areas out in the suburbs of Houston where we offer a large amount of cancer services and cancer care. So I spend part of my time out in the Woodlands. We have a location there. There are also locations out in West Houston, out towards Katy, as well as in Sugar Land and League City.
So what's the closest to, say, the Humble, Kingwood, Atascocita area? What's the closest MD Anderson that you can get normal treatments here?
Yeah, so closest to here would either be the Woodlands location or TMC, depending on traffic and how close you are to the highway.
Okay, right on. So we talked a little bit about a second ago about screening yourself and protecting yourself and make sure you have a good baseline. So whenever your doctor, your primary care physician says, yeah, we have a bit of an abnormality here we need to address, what steps do they take to get in touch with your team? Or should they bounce it off 2 or 3 referrals that the doctor may have? What's the best process, do you think? And, basically, what would you tell a family member to do in order to get it treated as soon as possible because it's something that could be aggressive.
Right. So what typically happens is a primary care physician will order some additional imaging like a mammogram ultrasound to further work up what we're feeling if there's something abnormal. Right. So usually that's followed by a biopsy, assuming it still looks very suspicious under the ultrasound or mammogram. And those biopsy results will often come back and be discussed by the primary care physician to the patient. Now, once there is an established diagnosis of breast cancer, that's when patients are then referred to MD Anderson.
Okay.
And so there's a few avenues that can go through, but in general, we have a patient access team where patients can call or go online and actually fill out their information, or patients can get in touch with our team and be scheduled for a new appointment visit.
Okay. Yeah. So when they do get that new appointment visit, typically is your field, is your specialty, is that the first avenue they're going to go down? Is that the first person they're going to be introduced to, someone with your direct team, or is there a layer before you?
Great question. So we have an intake nurse navigator who's often in touch with our patients even before they step foot onto our location. And they'll be calling them at regular intervals, checking in until the date of their appointment. Usually for our breast cancer patients, when they come in for our first visit, they often have 2 appointments scheduled, both with a breast surgeon as well as with a breast medical oncologist like myself, where we review all of their breast imaging, we review their pathology from their biopsy and other important parts of their case, and come up with a unified plan of what we recommend is the best approach to treat this individual patient's breast cancer.
Yeah, that's one of the nice things. I mean, as we've gotten older, probably not, you're quite a bit younger than I am, but whenever I was a kid, right? So my primary care physician treated everything from surgeries, knees, stitches, you name it, right? Which was great because I had access and very quickly could get things resolved. But it is also nice to know that people, and MD Anderson specifically is understood that there are needs for specialties and to go down very narrow paths. Unfortunately, sometimes you have to be reintroduced to several doctors to get it, but the specialty, you get into such a finite detail of what a treatment could and might be that MD Anderson's realized that value. And I think that could make or should make everybody feel better about the treatment plan, right? It's not Dr. Wright specifically making the plan. It's Dr. Wright and, how many people get involved in that decision, right?
Several people, several individuals. And what often most patients don't realize is there are several different types of breast cancer, and they're often treated differently. So to come up with an individualized treatment plan that's catered towards the exact type of breast cancer is really important. And it's really important that your team is composed of experts who treat breast cancer only.
Yep. Yeah, that is pretty cool. So, let's talk about the nerve-wracking part of it, because I think that's a lot of people's reservations, me included, right? So when there's an abnormality, anything going wrong with me, I'm one of those guys, I'll get over it, right? And and in this case, it's a little bit more scary, and they maybe don't want to get the bad news, and maybe they are a bit nervous about the process. So really, I think it's important to lay out the experience that your team has getting them in the door, getting them comfortable to come in the door, and then how, there's the bedside manner, I guess is kind of the way doctors say it, right? And I think it's important to know with y'all's history and the experiences you have, it should be a lot more practiced and an experience that helps you address and understand the psychology behind what's going on in that individual's mind. So have you had experiences where you've had to do a lot of getting people at ease?
Definitely, yes. So early detection is key, and although there can be a barrier, there can be some initial fears, it's really important to go and get that screening mammogram because early detection is so critical. The earlier the stage of the breast cancer, the higher the likelihood of a more favorable outcome. But we definitely do see a lot of patients. It's normal, it's natural for any human when you're diagnosed with something like cancer to be scared, to be afraid, to have a lot of questions, to kind of have your mind race and move for a lot of things, right? It can be really scary. So we understand that it can be a really challenging time. So we will talk with patients and take our time to get to get to know them better, know what's important for them, and know how we can help them. If it gets to a point where patients become so anxious or so depressed with a diagnosis like this that it's affecting their normal function, then we definitely their day-to-day activities and they can't sleep well. And we definitely often reach out to our other specialists to help support controlling anxiety and depression, whatever it may be. But it is a normal, natural reaction when you're faced with a life-changing diagnosis like cancer to sort of reevaluate your life, and you're going into the unknown. And oftentimes our patients will tell us sometimes the scariest time is the time after their biopsy until their first appointment with us, because their mind races. They don't know what we're going to discuss. They don't understand prognosis. You can go down a rabbit hole and read anything online, and you have to really be careful and consider your source. It's good to be well informed and engaged in your care, but it's also important that you have our team of experts review your case, because every individual case is so different.
Yep. Yeah, I mean that's the value of having a hospital like MD Anderson, right? And that's why it ranks so high. I and it's a weird story, but I just so happened to trip on it on an article, and I'm like, what does go into this rating, right? So there's survival rates and all these different factors that go into it, and a lot of it has to do with money spent by MD Anderson into research, and what you guys are doing to give back and help maybe educate and all those things. So do you know what factors go into why MD Anderson is considered the number one cancer hospital in the world?
Great question. I don't know all of the factors. I know definitely includes some of those ones that you had mentioned. I know our reputation is focused on clinical research and involving patients in research. Not all of our patients are on clinical trials, but we do have several patients who are on clinical trials to help us better understand how can we improve our treatments and have an impact in patients for 5-10 years down the road, knowing that we found a different treatment that's now better. So I know that's a big part of it, but also part of it is we've been doing this a long time. We have a very robust team, a large team that allows us to really subspecialize in treating different types of cancer. And it's not just a team of physicians. We have a huge amount of support staff from our nurse practitioners, physician assistants, social workers, nurses. We have so many different types of nurses. So it's really, it does take a village, and we're just one pillar of support for our patients. I often talk with my patients that although we're your support and from your medical team, it's also really important to have support at home, whether that means family or close friends. It's really important to help guide them through this journey together, because really at the end of the day, none of us are in their shoes. We're not in their shoes, feeling what they're feeling, thinking and having the same experiences. We all want to help in any way we can. And if we can't help, we can reach out to whoever can help address whatever that issue or concern is. But we're all hands on deck. We all want to roll up our sleeves and help any way we can.
Yeah. Now it's nice. I was thinking about that as you're going through the process of, I don't want to say onboarding a patient, but getting them under your care, right? I was thinking about, okay, at what time, and obviously it's a patient's decision on what time to enlist their family in the decision-making process and to make sure that the family's there for support, right? So if something like this happened to my wife, I would want to be immediately involved, right? But is that her wish? And that's what doctors have to balance, understanding that it's probably important to explain to them that's a great deal of value to have your family behind you. But also you have got to you have to understand it's the patient's decision, right? So do you have ever scenarios where people are kind of nervous about when to include their family, and do you have support at MD Anderson that maybe best practices or those kind of things? Hey, a history says that if you engage them in this time of the process, it's going to make your well-being, both the psychological side of it as well as the physical side of it, be a better outcome for you. Have you had those type of experiences?
Yeah, so we recommend having the family involved as early on as possible, but we also at the same time respect every patient's individual wishes. And so that may not be the case for some patients, but for most of our patients, there usually is at least one family member or close friend that they have confided their diagnosis in and have as a pillar of support. We do, from time to time, have a patient who does not like to share with their family or friends because they're worried about being a burden, or they feel like their close loved ones are too busy, and they really don't want to be a hassle for them, right? So on rare occasion, we do see that, and we do try to talk with them about why we recommend having family important early on as a pillar of support, because this is a journey, and it's a lot harder going through it alone and with less support and having more involved. And now I can understand it not wanting to have your whole extended family and all of your friends know, right? That can be a bit
Yeah,
overwhelming for some
let's not
people.
post it to Facebook.
Right, exactly, exactly. But on the rare occasion, we do have a patient who does not want to tell any family member or close friend. Usually, when that happens, we'll reach out to our social worker to try to help offer some extra guidance, support, and resources about maybe they're looking at the best way to approach or to tell their family member. Or oftentimes, if there's young kids involved, depending on the age, how do you tell your young kids that you're battling breast cancer? So it can be very nuanced, and every patient's different. So we try to individualize our recommended plan and how to best move forward.
Yeah, I could understand that, right? So, a lot of us have young kids, and unfortunately, it hits people young. It's not one of those that says, "Hey, you've got to be 55 years old before you have to worry about this." I mean, I have friends that were in their 20s that it occurred. So, we're blessed, right? Me and my family are blessed that this hasn't happened. But once something like this does happen, okay, how do we engage my 10-year-old and explain to him, well, dad or mom's not going to be feeling physically up to certain things, right? And I think that MD Anderson does have some programs that help give you recommendations, is what you're saying.
Definitely.
Yeah,
Yes.
right on. Okay, good. Okay, so let's talk a little bit more about MD Anderson and why we're so proud to have him in our community. One of the things that's going on right now, we've got Breast Cancer Awareness Month, the pink shirts, all the fun stuff. But it's cute to wear pink ties. But really, what does that mean for our community? And really, what is the goal for a breast doctor like yourself? What is the goal to make sure we're aware of what's going on in this world?
What I'd like to highlight, the main importance is to have breast cancer awareness and to have a good understanding of what your baseline breast tissue feels like. If you notice anything different, go see your primary care doctor, and also to get your screening mammograms. Screening mammograms really detect breast cancer early, and as I mentioned, when breast cancer is caught in an early stage, the earlier it's caught, the more likely you're going to have a more favorable outcome. We try to prevent breast cancer from showing up later or elsewhere in the body, because at those later stages, there are worse outcomes. And we want patients to live as long as they can for as well as they can. And once they are diagnosed with breast cancer, we want to get them treated appropriately and move on with the rest of their life, keep doing what they love to do, and have a history of breast cancer, maybe something they take a medication for, but still go on with their life.
Yep, the survivors, and there's a lot of them, right? We the in the pink stuff's going on, and we had a dinner the other night at one of our friends, and it was to benefit, right? And I couldn't believe the women that I hang out with normally, like interact with often, and they're survivors. You're like, really? Wow. Oh yeah, I was 32, and you're like, I'd never heard that story. So it's neat to understand how many they walk amongst us, right? They're
Absolutely.
around us. So it's you've got a support structure, and once if you are diagnosed, it's definitely a concern, and it's definitely something that needs to be addressed. But let's not think it's the end of the world. Let's go down the path, be aggressive about getting addressed, and then be a survivor, right?
Right, and try to think positively. But I'm sure most of us know at least one, if not multiple, women, maybe men, who have been affected by breast cancer. And it's unfortunately very common. The statistic quoted is 1 in 8 women will experience a breast cancer diagnosis in her lifetime. So we definitely know more than 8 women, all of us, so can think of multiple patients or multiple friends or family, people we know who will often be later diagnosed. Now, the risk of breast cancer being diagnosed does increase with age, so it is more common in postmenopausal women. But unfortunately, we do know and we do see several young women, young patients who are diagnosed with breast cancer in their 20s and 30s. It's not unheard of. It's not very rare. We do see those we do see breast cancer in these young ages, unfortunately.
Okay. So the last thing I kind of wanted to go through was what I find, and a lot of the people I talk to in our community find is the most important is the give back, right? So I see MD Anderson. I know they're part of our Chamber of Commerce. I know they give back to other chambers of commerce. I know that they are in and around the community. I know they do education classes out there, often on prevention, all types of cancer prevention. What do you know about what MD Anderson as far as their give back to the community? What are they involved in? What are they passionate about?
Yeah, so we try to be as hands-on and involved in our community as possible. So whether that's through the Susan G. Komen Foundation or Race for a Cure, or it's through other fundraisers in our community to help raise funds for supporting families who are going through breast cancer diagnosis or a cancer diagnosis in general, or raising funds and money for clinical research and how we can advance our knowledge and make progress in the fight against breast cancer or other types of cancers. But definitely through other avenues, as you had mentioned. So reaching out to through primary care doctors, but also other community organizations to give talks and to become engaged, to bring awareness to what we can do to try to detect whether it's breast cancer or other cancers earlier, the importance of getting mammograms, screening colonoscopies, other ways that we can detect different cancers early, pap smears, really important. So whatever we can do to try to help our community, make our community healthier, is all part of our goal.
Yeah, yeah, perfect. I mean, that's why whenever mom and dad, my parents are a little bit older. They're 54. What does that make them? 60, 69, right? Dad 69, mom 67. So they're a bit older, but they just recently moved from Little Rock. One of the things you've got to consider as you age is how close is hospitals to your home. And literally, as they were moving from Little Rock to here, I'm like, well, you ain't got a problem. We've got some of the best medical centers, luckily, in Houston. I mean, it's the fourth largest market, so we're naturally going to have. But I think proportionally speaking, this is kind of heaven for hospitals. We are very blessed to have it.
Agreed.
Yeah. So okay. Anything that we failed to discuss about your practice or MD Anderson or how important it is to get screened and anything else we want to disclose, Dr. Wright?
I think we've hit the highlights. I know we talked a lot about screening mammograms, having breast awareness. Those are really important. If you notice something different, please reach out to your primary care doctor and go from there. And
okay. So is there any way you would like to leave to get a hold of you, or any would follow on Facebook? Do you have any kind of Instagram or any normal things that you publish information to help educate the community?
So I'm not personally involved in social media. I try to steer clear of that.
Understood.
But
Me too.
I recommend our patients go to our website at mdanderson.org to find a provider, to find a location that is best fitting for your needs.
And you do have some education sources on that site, I assume, as well,
Yes,
right?
sir. Yeah, we have several different places where you can click for patient resources and even caregiver resources also.
All right. Well, thank you, Dr. Matt Wright with MD Anderson. And thank you, MD Anderson, for spending time with us this morning. Again, it's a value that we all realized and hopefully don't need, but it is something in our community that is, access to healthcare is one of the scariest things that some communities don't have. And we are blessed to have a lot of it. So thank you very much for what you do. And again, get yourself checked. Know, as Dr. Wright says, know your baseline. Notice any changes, go see your primary care physician, and then hopefully we don't need their support. And if we do need their support, we get it early, right?
Absolutely. Thank you so much for having me. It's my pleasure to be here. As my grandma would say, your health is your wealth. And it can be hard, but we really need to prioritize our health over all else. Because at the end of the day, it's our bodies, and it's going to be really important that we advocate for ourselves and we go and get checked out and see our physicians regularly. So thank you again for having me. It's really been a pleasure.
Yep. Thank you, Dr. Wright. You'll have a good morning.
You also. Thank you.